Welcome back, Care Partners. This is Memory Care with Teresa. I'm so excited you came back for episode number 2. Hey, I got a question for you. If I have dementia, does that mean I have Alzheimer's? That's what we're going to talk about today. So, thanks for coming back. You may want to get your pens and pencils out. And for those of you who are listening just on audio, I tell you what, there's going to be some PowerPoint slides today and a little more information. You may want to come over and watch us on YouTube also. That's completely up to you. But there's going to be great information. Thanks for coming back. So, today, our sponsor is Activate Brain and Body. And let me just tell you about this amazing company located, well, the one I know is right here in Cincinnati, Ohio. Activate Brain and Body. Are you experiencing brain fog, concerned about your memory, or have a family history of cognitive decline? At Activate Brain and Body, they might be the best fit for you. At Activate Brain and Body, they combine physical and cognitive training to help people work on their cognition, strength, endurance, balance, and working memory. If you're looking for certainty in both your physical and cognitive training, a research based approach like the one used at Active Brain and Body, it's the way to go. So, the best way to learn more about what they do is to go to activatebrainandbody.com or feel free to call them for a tour, 513-793-2724. They're located in the heart of Montgomery in Montgomery, Ohio. And Mike Gelfgott, their CEO, he'll be there to help you and give you a tour. Not only have I been to Activate Brain and Body, but the exciting thing is they brought me in to train their staff. So I was completely excited about this company and got to watch what they're doing, got to see some folks that are that have dementia, that already have diagnosis, that are there working out to keep themselves their best self. So anyway, Activate Brain and Body. All right. So let's go back to my question. If I have dementia, does that mean I have Alzheimer's? It's a great question. And the reason we're talking about it today is because this is the most popular question that I have when I teach. When I'm out doing speaking events, there's always somebody who raises their hand and asks this question. So is it if I get Alzheimer's, I have dementia? Or is it if I have dementia, I have Alzheimer's? And here's the deal. Not necessarily. So let's talk about this. I want to first talk about the fact that dementia, in my terms, would be a collection of symptoms. And the thing is, my mom's symptoms are going to be different from your loved ones. They're different, but there are lots of symptoms that make us worry that maybe this person needs to be checked out. Like maybe they do have some form of a dementia. So in a minute I'll give you a definition of what a true dementia is, but first I want to talk to you about some of the common symptoms, because families tend to brush under the rug or look the other way when some of these symptoms are happening, because you know what, here's the deal, guys, we don't want our loved one to have this. We don't. And that's why we frequently see family members or even the patient themselves in denial, in complete denial. And I tell you, my own dad loved my mom so much and he was so close to it. He didn't want her to have this. And for a couple of years, I really think he turned the other way and just was the enabler in order to keep the peace. Okay. So, what would you say would be a common symptom of dementia? What would be a common symptom? Well, memory loss is really the most common, I would say, but is it short term or is it long term? Yeah, it's short term. For most people, it is short term memory loss that they see, and sometimes it's long term, but for a lot of folks, the majority of the folks, they really can keep their long term memory. And you know what? You can enjoy them back in time. You can remind them about that great camping trip they took with you when you finally turned 13, and it was the best camping trip of your life, right? You didn't see any bears, but it was a good camping trip. And I bet you bring a smile to their face. But we avoid those words like, do you remember? Do you remember? Do you remember? No, you're telling them a story. You're sharing a memory with them. And in the process, giving them praise and giving them excitement, about something that you shared with them. So that would be a common symptom. Maybe getting lost. That might be a symptom. That can be scary. Sometimes we're back in time and we're looking for that J.C. Penney sign, because J.C. Penney was there. Now, J.C. Penney may be long gone in your town, and maybe there's a Macy's there or a newer store. But in their mind, they may be 20 years back in time in that moment, and they're looking for a store from way back when. So that can be frightening. I've read that folks can drive 30 miles out or 300 miles out of their way, like on an interstate, looking for that sign that says J.C. Penney. Okay, that can be so scary. Um, maybe your loved one is repeating themselves. Maybe they because of the short term, they're asking, what did you where when are we leaving, when are we leaving, when are we going, where are we going? Or maybe you've got the, I want to go home, I want to go home, I want to go home. And it could be something like grandma's not really fixing that apple pie the way she used to, didn't seem to taste the same. Because for some people, sequencing is part of the problem. It really depends on what parts of your brain is experiencing the decline, the damage, as to what kind of symptoms you're going to experience. Some of these people recognize they're losing it and forgetful. Some of them do not. Some folks become more rude, and the filter between their brain and mouth seems to disappear. Have you heard that before? Like all of a sudden they say something completely off the wall, and you're like, "Ooh." Or maybe, you're sitting at dinner and they make a rude comment about the waitress, and you're like, geez, Dad, and maybe he didn't do that before. But that could be a symptom too. So it depends on what part of the brain. But here's the deal with all of these symptoms. Well, and hallucination, we didn't talk about that. Hallucination is associated with some forms of dementia. And maybe they're seeing things. But, then I always throw in, is it macular degeneration? Because I had a nurse friend who would see a spider come flying across, her visual screen. And it was really just an eye disease that she was dealing with. So we don't always know. But again, we got to join them on the journey, don't we? And help them along and see them through this. And so once we get about 5 or 6 symptoms that are undeniable, like maybe they got lost, maybe they couldn't find their way home from church in the car, maybe they didn't recognize our close relative or a neighbor, maybe they're getting up at all the wrong hours, wanting to do all the wrong things. But we can usually, statistics show that they probably have symptoms for several years, maybe up to 5 or more, by the time they can't cover for these symptoms anymore. And then it becomes a real problem. And then most folks decide to get it checked out. All right. So let's go on to maybe slide number 5. So the truth is, guys, every person's symptoms are going to be a little bit different. All right. Your loved one's symptoms will be different from mine. My mom couldn't understand that she had to do therapy after a knee replacement, or after she got the knee replacement, she did therapy, she walked for a while, but then she decided not to. We brought therapy back in. She'd say she'd do it, but when they got there, if it was uncomfortable, she'd send them away, and sometimes send them away with a couple of comments. And so these were like off the wall things that weren't like her. She was a very kind person. And so why was she acting this way? And why wasn't there any logic about the fact that you have to do therapy, you have to do the OT and the PT, and you got to exercise in order to stay strong, because it's move it or lose it, isn't it? These old bodies, I mean, let me tell you, once you get past that big 50, you got to be doing something to maintain what you have. If you want to get, be walking and squatting down to see the grandkids in your senior years. So everyone's symptoms will be a little bit different there, and that's normal. That's still dementia. Let's do slide 6. So the question is dementia a diagnosis? And the answer is no. Dementia is really the collection of symptoms, guys. It really is. It does mean 2 parts of the brain are dying. It is progressive. It is terminal, right? But you know what? So is life. We're all going to go from something. The interesting thing about when you have some type of a dementia is that, It's usually not quick like a quick pancreatic cancer or anything. This can be a long time. We have to come alongside. We have to learn how to love them through this and keep increasing care as their brain capacity declines. Okay. Um, I think that makes really good sense. Let's bring up slide 7. You can just see the facts about dementia. 2 parts of the brain are dying for true dementia. No medications are currently curing it. They do have medications that are being tested to work on plaques and tangles. We're having some bleeding issues, so it goes back and forth about, and we can't get Medicare. Medicaid has not jumped on board to approve these medications, so it's not really, I would say, something available to everybody. There are some medications that doctors prescribe frequently, the Ariceps, the Namendas. Um, that are about 40% effective, according to my pharmacists. And, but they do have some side effects. We got to try them one at a time. And they may help the brain cells talk to each other chemically or physically, right? So they may improve things a little bit. It's worth a try. It's worth a try. I wouldn't put all your, hopes into that because it may not be, but it is always terminal, this thing. But so is life. And so, um, what I can tell you is, Alzheimer's, on the flip side, has been associated with these amyloid plaques and the tau tangles, right, that damage brain cells. But it's just one of many diagnoses, guys, that cause brain failure. Even though it's the most popular one, some will say 60% at least of the people out there with dementia have Alzheimer's. Some will tell you it's closer to 80. But either way, it's one of 110 different diagnoses that give us these symptoms of dementia. So dementia is just a collection of symptoms. Now, what if your loved one decides they're not going to the doctor? Maybe they already have a fear. Maybe we've let this go too long and now they're too afraid to go to the doctor, which was the case in my mom. She wasn't going to any doctor and she didn't need to go to any doctor either because honestly, she couldn't see her disease. And so, but it's so important to get it checked out to make sure that they're really not experiencing something else that's not a true dementia and really is just another type of brain failure. So yeah, 110 different diagnoses. That's pretty wild. Let's go to, yeah, this is perfect. So this is a wonderful slide that comes from one of my mentors, Teepa Snow, right, with Positive Approach to Care. There's a lot of information on this slide, but as you can see, dementia is really what we call an umbrella term. The top of the umbrella is your loved one's symptoms. And then the doctors will put it together and try and find out, well, does it look like it's Alzheimer's? Is it frontotemporal? Is it Lewy body, vascular? Those are the more popular ones. And we will break those down in future podcasts. But for today, we're really just focusing on the difference between dementia and Alzheimer's. Alzheimer's is a true diagnosis, dementia is not. We end up with the diagnosis of dementia sometimes when we can't get our loved one to go to the doctor because we've waited too long and now they're too afraid. And, if they've got arms and legs stretched out on the frame of the house and you're trying to get them out of the house, it's not going to happen. And so we have to go to plan B, and we do what's called symptom management and comfort care. And that's okay if that's where we are. And there are plenty of physician services that come to the house now. You can get physician assistants, you can get nurse practitioners, fabulous people that can come to the house and see your loved one at home. Do we tell your loved one they're coming? Well, it depends on their disease. If they're resistant to people coming, then I'm going to have them knock on the door and just be a surprise. Because frequently, people with dementia, they'll use the right side of their brain and be more cordial to a stranger. Where if you tell them, hey, don't you think it's time we get a doctor to come into the house? And they may tell you no. And then you feel like you're sunk or that you can't go back on that. And so sometimes we just allow that person to knock on the door. We did that with my mom, and she loved that gal coming once a month to see her. And honestly, guys, it was a copay for my mom's Medicare. So it was no more expensive. It was certainly a lot less hassle than trying to drag her out of the house. So in a quick review about dementia, dementia is an umbrella term. It is your loved one's symptoms, okay? The symptoms vary greatly, but the thing is that there are more than 110 diagnoses that can cause them, okay? It could be an alcohol syndrome, it could be a vitamin deficiency. And so it's so important to get it checked out. But if we don't, we don't. You can't take someone kicking and screaming into, and certainly they're not going to endure an MRI or a CAT scan or a PET scan or a spinal tap, which they're using nowadays to maybe make a better diagnosis. Because sometimes some of these diseases you see on that chart, they're officially not diagnosed until we do an autopsy. Well, that's just not available when your mom's still kicking and screaming. So that's not available. And so then, sometimes they end up making their best guess by just the symptoms we're seeing and maybe if medication works or doesn't work. So dementia is a collection of symptoms. All right. But a true dementia means that two parts of the brain are dying. It is progressive. It is terminal, but so is life. So let's just decide how to enjoy it, right? Um, we'll move on. There's a few other things to consider. So before we assume dementia, maybe it could be hearing loss. Hearing is not, although it's in the head and it's near the brain, it really is in a separate compartment. It really is not associated with those brain failures that we saw a minute ago. And so hearing, you either have hearing loss or you don't. I think all of us by the time we're in our, 70s and beyond have a little bit of hearing loss, but honestly, my mom could hear like an eagle until the day she passed. She really was amazing. Other people, hearing loss can complicate dementia because if the information can't even get to the short-term memory, right? The hippocampus, where then that should be sticky in there and that thought should stay. And when you sleep, then it should move back to your long term memory. But if it can't even get in, if it doesn't even get recorded, well, it's kind of hard for them to remember it. So hearing loss can really complicate. I almost feel like it advances a dementia. Living with high stress can make us look like we have a dementia, for sure. Living with high stress, all the cortisol, and it certainly can complicate a true dementia. Someone's acutely ill, in and out of hospitals and procedures and under anesthesia, boy, they can look like they have dementia. But I want to hit pause and let's recover them before we go putting them in a memory care. Okay. Thyroid disease can look like dementia. I had a woman call me once and said, I don't know what's wrong. He was fine and now, oh my goodness, he's not. It's just like he has dementia. And his thyroid had just stopped working. He was 80. But do you know what? After 3 months of getting the right medication adjusted, he was back 100%. So definitely worth getting these other things checked out to make sure, just rule them out to make sure that we aren't calling something a dementia that's not. Low B vitamin. And a lot of times that's associated with people that drink a lot of alcohol and have poor nutrition. All right. Medication problems or interactions. There was a gal at church. She didn't realize she was on some type of a depression med and well, she ran out of it and just elected to not refill it because she felt pretty good, right? Oh my goodness, her husband called and she was so forgetful. She was confused. She was anxious, very frightened. And they took her to the hospital. It took them a while to figure out because in that time she wasn't a very good historian. She wasn't able to give them the history that, oh, by the way, I did run out of my whatever medicine and didn't refill it, a week ago. So that's all it was, though. They got her back on that medication. And that's why it's so important that we just don't cut medications and DC them like they would in the hospital. I'd see it all the time. Let's DC that and start this. We frequently need to wean a lot of these medications, wean them on and wean them off because of the side effects that can come and can maybe it would be a productive medicine for them, but if we start it too fast or take it off too fast, it can really look ugly and have a lot of side effects that look like dementias. Pain or psychological issues, those can make us look like we have a dementia. Guys, we can't live in chronic pain. You can't. People just can't live in chronic pain. So it's so important that we get a handle on that and get good pain management, healthy pain management. So then we can work on everything else. But psychological issues, it's very, 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 very difficult to separate mental health and dementias, depression and Alzheimer's. It's hard to sort, but depression still falls in the category of something that's treatable. It's not in the category of a dementia that's terminal. So we got to go to therapy. We got to work on that. We got to do that. And guess what? We all need therapy from time to time, and it's okay. All right. As someone who's a huge advocate for mental health and getting care for your mental health, um, yeah, because we get fear comes in there. We all of a sudden think we have dementia, we have an Alzheimer's. I must be dying of Alzheimer's, and slow down and get it checked out, and maybe get some counsel, and maybe you will feel better. Find someone to talk to. All right. Um, Let's review, though, some survival tips with dementia. I feel like every week I need to give you a few tools for the tool belt, right? Because that's what I do. Um, so speak slower than I do. I tend to talk very quickly. So I want you to speak slowly. Let's go ahead and keep slide 12 up. We're going to speak slowly and clearly and pause. Sometimes we speak in 2 or 3 word sentences. I know that sounds hard for me, but it works because it gives them time to think about what you're saying and not get all the words mumble jumbled up. And so, as you're loving someone through this journey, take the time to slow your speech down. Again, they lose peripheral vision, so you approach from the front, make sure they're aware that you're there before you touch them. Okay. And as you are communicating, be in a position where you're close enough that they can read your lips, and use your hands. You'll end up using more and more hand motions as we go through this, as their language and cognition declines. And for some people, it's quicker than for others. Depends on where the disease is in the brain. Okay. So make sure they're looking at you. And let's remember not to correct these people. They're doing the best they can with what they have left. And so even if you have to just say, oh, well, I never thought of it that way. I'm glad you told me. Thank you. Thank you for letting me know. Or maybe they're annoyed because someone stole their purse again. Oh my gosh, someone stole your purse. Get on their team, validate it, and let them know you're going to do something about it. That's not right. That shouldn't happen here. Or if if the nurse practitioner shows up and they're kind to them in the moment because they're social and they're cordial, but then afterwards they say, now why did that happen? You can be like, oh, I don't know how that happened. Can you believe they just show up? Medicare these days, right? And I am going to toss the ball on someone else who's not really around to defend themselves, but at the same time it maintains the relationship with me and that person. Do you get it? It's important to validate it instead of saying, well, you needed the care and you wouldn't let them come in. Oh, time out, time out. No, 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 no. That won't work. Better for you just to go with their flow, guys, and just be like, I know. Can you believe they just show up like that? Well, at least she was nice, and I'm always going to put a positive twist on it and try and lead them somewhere. But hey, by the way, it is lunchtime. Grilled cheese, my favorite, your favorite, and then move on to something, to a happy place. Okay. So we don't correct them. We accept and agree, accept and agree. Oh, and then don't rush. Oh, the worst thing we can do for these people is rush them. Really, the worst thing we can do for most people is rush them. Very similar with, our children that have learning disabilities and things. They don't do well when you rush them either. But most people don't. So don't rush these people that have brain failures. Okay? Don't rush them. Say you're sorry over and over and over again. You know what? The best diffuser of their agitation is going to be you saying you're sorry. And so I hope that you'll use that over and over again and avoid those yes, no questions. Just avoid them. They learn to say no about everything. And so I hope that you'll pay attention to that. So the answer to the question, if you have Alzheimer's, do you have dementia? Yes. Yes. If you have Alzheimer's, it's a type of dementia. But if you have dementia Do you have Alzheimer's? Maybe, but that's not a given, is it? Because there's at least 110 other diagnoses it could be, and it really could be something else that's going on in your life. Maybe your thyroid's on that needs to be on the mend. So anyway, thanks for being here, everybody. Today, I am so excited to be with you today and tell you a little bit about our speaker for next week. Marion Kiner is going to be with us. Let me bring up a note about Marion. She is amazing, and she is a colleague of mine. She's a psychiatric clinical nurse specialist, right? She's a central nervous system educator, researcher, teacher, and consultant. And I think what you're going to find most interesting about Marion Kiner is that, well, she has a heart for people with dementia, but she's written curriculum for schools of nursing in Virginia. And she is in the University of Virginia teaching nursing students better ways to deal with dementia. How cool is that? And so I am so excited to bring her here to expose her to all of you. This is another part of the tidal wave, guys, that we have got to get going to let people know that there is more to this dementia thing than meets the eye. Like I didn't know, and I got kicked out of the blankety blank house, right? All right, so don't forget who our sponsor is today. Activate Activate Brain and Body, super neat place. If you are here in Cincinnati, give them a call and get a tour. I was so excited that they wanted me to come in and be a staff trainer over there. All right. Thanks so much for tuning in. We'll see you next week. And you got this.